Thank you for joining us. And, we know that, you're the founder of Shaping Motherhood and a maternal health practitioner yourself. So I'm sure the listeners are very, very excited to hear from you, especially on the breastfeeding week. So I just directly want to jump to a question, Parul. They say that there is a myth that there is, not enough milk during the first 3 to 4 days after birth, after once you've given birth. So you should give some formula until the milk comes in. What's your perspective?
See, I totally agree. That's the biggest myth that's out there. And that myth is something that I'm battling with every day in the hospital that I work with. See, the biggest challenge is that we perceive this, that, the baby is hungry or the baby is getting full only once the baby is gulping something down. Okay. So we want something in spoon to be fed to the baby, or the baby, is on the breast. So the thing is that for the first 3 days, there is a lot in the breast. It's actually colostrum, which is a thick, sticky substance, you can say. In Hindi, we call it "maa ka pehla gaadha doodh," which is absolutely essential for the baby, for its growth, for the immunity, for the strength. And the second perspective is, for example, our stomach is like a balloon, right? So if you go ahead and feed the formula 10 ml, 20 ml, 30 ml to a baby who's just been born, then you're literally stretching that tummy out. Now the mother will obviously get the transitional milk by the 3rd day. So between day 1 to day 3, she has milk, which is called colostrum, which is a little thick, sticky substance, which is absolutely enough for the child. Because the baby, what it needs is to be coming on breast every hour or so, every 2 hours or so, and just suckle and nibble on that colostrum. So this colostrum starts forming in a woman's body from 16th week of pregnancy. So from 16th week, the body starts collecting this precious golden milk, and then it just starts, storing it in the breast. Some women leak before the delivery, some women don't. Some women, the breast needs to be stimulated for them to be able to release that much of colostrum. So what should be your priority if you are about to deliver is no to formula unless and until your baby's blood sugar levels are dropping, or the baby is losing more than 20% of its birth weight within the first 48 hours. If these two things are happening, only then supplement your child with formula. If not, always ask for a lactation counselor's help to be able to latch the baby so that the baby starts getting that colostrum, which is absolutely an immunity booster that your baby definitely needs.
Sure.
So try offering the breast. Unless you offer the breast, the milk will be delayed even further. So don't do that mistake.
True. So the next question I wanted to ask you, whatever you said is so actually true. And being a mother, I've experienced it myself. But after making your baby, work at the breast and the latch works, a top-up of express breast milk or formula through a bottle, will it really ensure that they get enough or stay satisfied longer between feeds? Because the biggest issue that mothers have is they don't understand in the beginning, right? They're really confused that, is it enough? Did the latch just, get, did the baby just unlatch because the baby went to sleep? Is the baby's stomach filled? So can you highlight a little bit about this?
Absolutely. So one thing that as a mother you should notice is not the intake but the output. Because obviously the breast is not transparent, you can't really see what the baby is getting, right? But you can always see what's coming out, which is pee and poo, right? So if the baby is peeing 6 times in 24 hours, your baby is getting enough. That's the only marker that you need to look at. That being said, the baby doesn't come on breast. Understand this, it's been living inside of you for the 9 months. You've carried the child. The amniotic fluid tastes exactly like the colostrum that's there in your breast. The smell is similar. The baby wants that. Your heartbeat, the baby's been listening to it for 9 months, and now the baby is, somehow listening to so many sounds, getting in touch with so many people. There is so much going around the child. What baby needs is that familiarity. That's why it's coming back to your breast again and again, not because it's hungry. Because breast is not only to satiate. So just to answer this one more thing that you said, that do we need to top up with formula? I want to tell you that within 24 hours, if your baby is not peeing 6 times bare minimum, then you start topping up with formula, not before that.
Yeah,
Hello?
so I wanted to jump on
Yeah,
to
honey.
myth three, because this session has been so exciting in terms of breaking the myths, right? So breast milk is very light and it's adding or switching to formula. Does that help the baby sleep longer at night? Because they say that formula is heavier, so the baby's stomach is filled for a longer.
I agree. So yes, one thing, formula is definitely heavier. So formula is that puri sabzi and barat ka khana that we have. And breast milk is as simple as that ghar ka dal chawal roti sabji. But the thing is, how much can you have that puri sabzi wala khana? It will somehow affect your gut also, right? So when you eat something which is heavier, obviously you sleep a little longer. That's true. But do we really need that, is what my question to you or anybody who's listening to this is, that do we really need the babies to sleep that longer, or we need them to be with the mother? So if you want your child to sleep peacefully, first thing, keep the baby close to your skin. What I usually see is that the baby is in the crib next to the mother sleeping, and that separation becomes a very big problem with the baby sleep. Second thing, the baby sleep cycle is only for 30 minutes. What for us happens in 120 minutes for happens in the span of 30 minutes, and they need their naps to be bridged. So every 30 minutes they are bound to get startled a little bit. But with formula, the gut is so busy in digesting the food that they simply drowse it off. Now that's something that we don't want. The baby is not really sleeping peacefully. First thing first, make the baby wear a diaper at night.
Eat bland foods while breastfeeding to avoid your baby from getting, gassy or you're feeling indigestive. Is,
Okay, so to be very honest, the babies, when the baby is getting gassy or colicky, you should always look at the latch, whether the baby is, comfortable on the breast, or whether the latch is not right, whether the baby is gulping air during breastfeeding or not. That's one thing. There are certain underlying causes for this. It could be a tongue tie, it could be a lip tie, it could be a positioning or latch correction that's needed. When the baby is, throwing up curdled milk, we see this a lot, right? The baby spit up, and people try to normalize it, that what, bacche karte hi hain aisa, babies do spit up. But the thing is, it's not normal. If that is something that's happening to your child, always go ahead and check the underlying situations. Now diet, when we talk about diet has a very small role to play in this, not as big as you start eating bland foods altogether. With breastfeeding, you should have whatever you would want your child to have, which means healthy, balanced diet. All right. One thing that you can avoid is peppermint, because that affects the supply per se. It reduces the supply. That you stay away from peppermint. But mild spices, decently cooked food, even if it is chole or rajma, you can always go ahead and have it. Make sure you're having some sort of balancing or counter, thing with it. For example, you can have some kala namak and ajwain with it. If you're having that, then it won't cause that much of gas. So your gas doesn't make baby gaseous. Baby gets gas for its own reasons. So eat your heart out is what I would say.
Thank you, Parul, for sharing busting these myths for us. I have one more. Having pro-lactation food and supplements helps increase your milk supply. What's your thought?
So in my practice, years of practice, the biggest challenge that I see is that because for the first 3 days, you see that you're not able to see a lot of milk, because you're not able to see it. You're not able to, you express with your hands, but you can't see a lot of milk coming in. And you have this understanding, or people have around you have told you that what, behna chahiye doodh, that means it's enough, it should spray out, that means it's enough. Now understand this very clearly. Women, they go ahead and start having galactogogues. Galactogogues would mean something like methi, jeera, galact granules, some medication, Ayurvedic, to start, boost up the milk supply. Now, whenever I see my patients at 2 months, 2+ months mark, they always come to me with the same complaint, which is the baby's latching on breast, but I don't know why it just, moves the head away and start saying no with its head. It just starts moving the head here and there, and it doesn't want to latch. I don't understand whether I don't have enough milk or what is the reason. Now, here the biggest reason is the letdown. So imagine you're trying to drink water from a tap which is at high speed while opening your mouth. You will be waterboarded, right? Same way a baby feels when you take unnecessary galactagogues, which you don't really need to improve your supply. Your body is enough to make supply. 80% of breast milk is water. Make sure you're having 4 liters of water a day, or whenever you're thirsty, gulp down 2 glasses of water. That will also do with me. Have balanced meals. Your body will be able to make enough milk for your child. And all these things that are running in the market, or probably somebody will tell you, some friends would tell you, you know what, I had this tablet, it helped me. I had that powder, it helped me. Now the problem is it might not really suit you. That's the first thing. Second thing, it will certainly create a faster letdown for you, for which you will need to seek lactation assistance. Now, faster letdown also creates a lot of gassiness and a lot of colic in the baby and spit ups and all that, because the milk simply just directly hits the gut, and it becomes a problem because the gas starts forming in that situation. So stay away from these galactagogues unless prescribed by a lactation counselor. It's very, very important.
Thank you, Parul. It's very interesting. So I just had one question. Like, can you tell us what are your thoughts on pumping breast milk?
So I think pumping breast milk is a good idea if you want to boost your confidence, because that's the thing. That's how I use a pump for. So whenever I see a client or a patient in the office who are not sure about their supply, because we women have been suppressed by patriarchy for so long that whenever somebody tries to tell you that, you know what, you are enough, we keep doubting ourselves that, really, am I able to do it enough? Am I able to do this right? And since you're not confident, what I simply do is I get you to pump a little milk so that you can see those 15-20 ml coming out of your breast, so that you know it's there. Right? That's one way I use pumping. The second way is there are moms who want to return back to work, and since the maternity policy is only for 6 months, though a baby needs breastfeeding much longer, you can always pump and feed your child, because that's the next best thing that you can do. So obviously you go ahead and do the breastfeeding. The only difference that's there between pumping and feeding and directly breastfeeding is that the feedback loop is missing. So for example, your baby comes on your nipples, the saliva sends a signal to the brain that, you know what, I'm coming down with a cough or cold, I feel like it. Why don't you change the recipe of my breast milk so that it suits me? So that signal goes to the mom, and the body creates those antibodies, and the next milk that you will see or the baby will have those properties to protect through the upcoming infection that the baby is about to have. So that kind of benefit is not there in pumping unless you do skin to skin with the child, or bring the baby to the breast at least 2 to 3 times a day for the feedback loop to work for you. That's the only difference. Other than that, I think if you compare the breast milk, direct breast milk, and then pumped breast milk, and then donor milk, somebody else donating you, and then comes the formula, and then if even that is not available, then you go to bovine sources and everything. But directly breastfed is the best. Then second best is you pump and feed. So that's the best we can do in this scenario. A lot of moms do it, and I fully support that.
So I have last 2 questions, Parul, as we come to the end of the session. One is, are you a less of a mother in case you can't breastfeed? And the second is, a lot of women actually have more than 2 nipples, right? They end up having 3 or 4 ducts. How normal is that?
You said the first thing you said is that, are you less of a mother if you are not breastfeeding?
Yeah, because it's
so
the breastfeeding.
No, of course
we are
not.
asking all our panelists.
Yeah, no, absolutely not. You are not any less of a mother if you. So a lot of surrogacy clients, they come to me and they say that, you know what, I'm not breastfeeding and all that. So one thing is that there is an option to induce lactation even if you have not given birth. All right, that's one option for you if you're listening to this. Second is, if you consciously choose to not breastfeed, that I don't want to do it, it's absolutely your personal choice, and I will respect you for it no matter what. The only thing that I would though suggest is that if you're not going this breastfeeding route, you should always do KMC, which is kangaroo mother care with your child, so that even if not via breast milk, at least via the skin, the baby gets the immunological benefits that the breast milk can provide to your child. And that also calms you down and prevents any sort of postpartum depression in you. So if you choose to say no to it, I am with you in that situation as well, to support you and your dreams and goals and aspirations. But you should always speak to somebody before choosing whether you want to do it or you don't want to do it.
Any last minute tips or advice for the mothers who are breastfeeding?
Absolutely. So the first and foremost advice that I have for you is believe in yourself. Take a board marker, stand in front of the mirror that's there in your house, and write on it, I am enough and beautiful. All right? And read it, look at yourself, read it and appreciate it. You will feel like a fool for the first 2 days, but after a week you will start believing in it. The more you believe in it, the better you will do as a mother, because if we love ourselves, if we believe in ourselves, we can actually do anything that we want on this planet Earth. If you are a twin mom or a triplet mom, or somebody who has had babies via surrogacy, the thing is, you can breastfeed too if you really put your heart and mind and soul to it. I have had clients who have had triplets and not a drop of formula was given to either of the babies. So the point is, if you choose to do this, I stand by you, I help you, I'll always be your best cheerleader. And even if you don't, that you choose not to do it, then also I'm always here to fully support you.
Thank you for watching. For more such videos, do like, share and subscribe to The First Parents.